So I'm going to talk about some of the muscles of the knee. Most of the muscles that act at the knee I've already talked about. So just a reminder that you have for knee extensors is the quadriceps group. So we already talked about the rectus femoris, which will flex the hip and extend the knee. The other part of the quads are the vasti group. And the vasti group generally come from actually the posterior side. You have the vasti lateralis. It's going to come from the lateral lip of the linea aspera and come down to the wrap around to the tibial tuberosity. And then you have the vastus medialis. It's going to come from the medial lip of the linea aspera and wrap around to the tibial tuberosity. And then you have the vastus intermedialis. It's going to be anterior and lateral on the femur, and again come down to the tibial tuberosity. And the vasti group all only extend at the knee, but they do provide most of the extension force of the knee, and they're also femoral nerve, as is the rectus femoris. And it's also worth mentioning that the vastus medialis, many people, which is going to come from, again, that medial lip of the linea aspera, come in front down to the tibial tuberosity, people will typically divide that actually into kind of two groups. One, the vastus medialis longus that tracks down like that, but also what they call the VMO, or the vastus medialis obliquus, and that's going to track more in a horizontal direction. Okay, so it's just more of a medial pull. Another muscle that's specific to the knee is the Politis muscle, and that's going to come from the lateral femoral condyle, so it's going to be over here, and it's going to come down to the distal, or not the distal, the proximal posterior part of the tibia. And the Politis muscle is known as the key to the knee because while it will flex the knee, as it's going to pull posteriorly on the joint, it's mainly known for internal rotation. Okay, and that's because typically when you go into full extension at the knee, there's a little bit of external rotation that goes with that, and so in order to flex your knee, you've got to pop out of that external rotation, and that's what the Politis muscle does. Okay, so those are the two muscles of the knee. There's 4 ligaments of the knee that people talk about a lot that frequently get injured. There's the medial and the lateral collateral ligaments that go on the medial and the lateral side. And there's also the cruciate ligaments. There's the anterior cruciate ligament that comes from the anterior part of the tibial plateau, and then there's the posterior cruciate ligament that comes from the posterior part of the tibia. All right. We'll talk about the collateral ligaments first. Okay, so they're named for where they are. So the medial, can you see that okay? Mm-hmm. So the medial collateral ligament is going to come from up here on the femur down to the tibia. And its primary job is to resist a valgus force. Okay, a valgus force would be a force coming like this and would push out, would leave the knee like this if you had a valgus force. So that's going to stress the medial compartment, right? And this is also the position when we talk about genu valgum, this is that position, okay? The lateral collateral ligament is going to be on the lateral side. Okay, so it's actually going to go from the femur to actually the fibula, which is not on here, okay? It's going to resist a varus force, and a varus force would come from the inside and stress the lateral part of the joint, okay? And again, this position with the knee out like this is also known as genu varum, or what people call bow-legged sometimes, okay? So the primary role of the collateral ligaments is to protect against that frontal plane movement, either valgus, which is going to stress the medial side of the joint, the medial collateral ligament, or varus, which is going to stress the lateral side of the ligament, lateral side of the joint, or the lateral collateral ligament. They are also going to be tight on full extension, so they're going to resist extension, and they will also resist the extremes of axial rotation. If you can imagine them being tight on full extension, they're also going to prevent this twisting motion, which is what we're kind of talking when we talk about axial rotation. The other important point is that the medial collateral ligament, which is injured a lot more often, that actually attaches to the medial menisci, which is obviously not on here, but those two are attached. So quite frequently, if the medial collateral ligament is injured, the medial meniscus will go with it. So those are the collateral ligaments. The cruciate ligaments, like from their name, they're going to cross. So like I said, the anterior cruciate ligament comes from the anterior part of the tibia in this intercondylar region. The posterior comes from the posterior condylar region. All right. The anterior cruciate ligament, which is the one that you hear about the most, that gets injured the most, is going to cross over, come behind, and come from the medial side of the lateral femoral condyle. So it's going to be over in here. Okay. And its primary role is to prevent anterior translation of the tibia. So if you can remember, anterior cruciate ligament, anterior translation of the tibia. Okay, so the tibia coming too far forward. That can happen either because the tibia moves too far forward or if the femur is pushed posterior. Okay, so notice the tibia can move too far forward. That's going to be anterior translation, and that would happen in an open chain context. But if the foot is fixed, so if the tibia is fixed and the femur is pushed posterior, that's also going to result in the tibia being too far forward, and that's also going to stress the ACL. Okay, because the ACL crosses over the way that it does, it's also going to resist the extremes of axial rotation, like the collateral ligaments. It's also going to resist varus and valgus, similar to the collateral ligaments, both varus and valgus. And it also is tight on full extension. So normally in this position, your ACL is tight. Okay. The PCL comes from the posterior part of this intercondylar region, and that actually is going to go to the lateral side of the medial femoral condyle, so up in here. So it crosses as well, but it's a little bit straighter by comparison. And the PCL is actually loose, is actually on slack when you're in full extension. It's going to become tight on full flexion. So it's kind of the opposite of the ACL in that way. And it's also, again, if you can remember that it attaches to the posterior part of the tibia, you can remember that it prevents posterior translation of the tibia. Okay? And just like I described with the ACL, you can have that translation happen because the tibia itself comes too far back, or the femur can come too far forward. Okay, so whether it's the tibia moving on the femur, which would be an open chain kind of movement, or if this tibia is fixed, if the foot is fixed, the femur comes too far forward, that's also going to stress the PCL. A common example that's given of an injury is what's called a dashboard injury. So if you can imagine my thigh is a dashboard, and the leg hits the dashboard, the tibia stays here, the femur keeps going. So that's an example of a PCL injury. The PCL, like the ACL, is also going to resist the extremes of axial rotation, so any kind of twisting on here, and it's also going to resist varus and valgus, the extremes. But unlike the ACL, it becomes tight on flexion, not extension. And the way that it's not injured nearly as often as the ACL, the way that it is commonly injured is when you fall on a flexed knee, because that's when it becomes tight, and it frequently becomes injured if other ligaments are injured as well. All right. So just quickly reviewing, you have the collateral ligaments, the medial and lateral collateral ligament. Okay, they help resist full extension. They also help resist rotation, and then the medial collateral ligament is going to resist a valgus force, and the lateral collateral ligament is going to resist a varus force. Okay, the ACL and the PCL are both going to resist axial rotation and varus and valgus. Okay. The ACL is going to resist extension, okay? The PCL is going to resist flexion. And then in terms of translation, remember the anterior cruciate ligament attaches to the anterior part of the tibia. It's going to resist anterior translation of the tibia. And that can happen because the tibia moves too far forward or the femur moves too far back. Okay? Conversely, the posterior cruciate ligament attaches to the posterior part of the tibia. It's going to resist posterior translation of the tibia or anterior translation of the femur. The way that the ACL is the most commonly injured ligament that you hear about, and the way that it's most commonly injured is not through contact, but actually when you have a situation where the foot is fixed, okay, there's a strong activation of the quadricep muscles, and then on top of that, there's some kind of either rotation with some kind of twisting, possibly after a rebound or after a jump, or especially there's some kind of valgus collapse. So if the person tends to kind of collapse inward, okay, this kind of valgus collapse, I should put it like this, there's a strong rotation component with the foot fixed. That's actually the most common thing that you see, because if you remember, when you're in full extension, you don't actually have any rotation, okay? You have rotation as you have flexion. And in general, most of the ligaments, except for the PCL, are actually going to be loose on flexion. So it's that fully extended position combined with the weight fixed and the twisting on top of that, okay, or possibly a valgus force, where people commonly get injured.